There's a couple different ways that we conceptualize pain. The most common one is the biopsychosocial model of pain. And then we'll talk about the gate control theory of pain. So the biopsychosocial model of pain talks about different factors that influence how we perceive pain. So there's the biological side, which is, severity of the injury, how your body kind of just generally processes pain, low, high pain tolerance, kind of things like that. The psychological part is how we think about pain, right, and our perception of pain and how we kind of cope with it. And then social is kind of our setting, so our environment. What are some things in our setting that can improve coping with pain versus make it a lot harder to tolerate the pain? And so a lot of behavioral management strategies kind of target the psychological and social aspects of the biopsychosocial model. The gate control theory of pain is a little bit similar. Some people call it the gate, some people call it the dial of pain. So if we think about if the gate is closed, that means we're not kind of processing any pain signals, right? So there's the injury, but it's kind of like not going through the gate. If the gate's half open, half closed, that means that we're doing something to allow the pain signals to go through, but not fully. And if the gate's fully open, that means we're processing all of the pain signals that the injured body part or the chronic pain body part is sending our way. And we work a lot on learning strategies to kind of close the gate as much as possible, or in other words, turn down the dial of the pain. And so in our next video, we'll kind of chat about ways to manage that, but I figured I'd kind of talk about pain and why psychology is even involved, as well as how it's processed in our brain. So thanks for listening.